Just a quick review of the book, Ultrasound Evaluation of Peripheral Nerves and Focal Neuropathies. So basically the book's divided up into a whopping 17 chapters. So I'll name each one briefly just to give you an idea what's in the book, see if it's something you're interested in. Chapter 1 is kind of an introductory chapter. 2 is electrodiagnostic assessment of peripheral neuropathies. 3 is introduction to high-frequency ultrasound. 4 is ultrasound evaluation of peripheral nerves. 5 is ultrasound evaluation of muscle. 6 is evaluation of the brachial plexus and the thoracic outlet. 7 goes into evaluation of the nerves about the neck and shoulder. 8, evaluation of the radial nerve. 9 is the median nerve, and 10 is the ulnar nerve. 11 goes into evaluation of the nerves about the hip and thigh. 12 covers evaluation of the fibular nerve. 13, the tibial nerve. 14 goes into evaluation of other sensory nerves around the leg, foot, and ankle. So 15 is principles of ultrasound guided procedures. 16 is ultrasound in generalized neuromuscular conditions. And 19 closes with innovation and future directions for peripheral nerve ultrasound. So yeah, as you can see, the book is very comprehensive. I guess in summary, it'd be a really good resource for anyone who wants to expand their knowledge of peripheral nerves and focal neuropathies. Now, if you do a lot of scanning, another resource I want to bring up is kind of hard on your hands, your shoulders, your neck. There's one other resource I want to bring up: easy exercises and quick fixes for sonographers with pain. Basically, this takes the most stressed out tissues that a sonographer has, and it starts with the thumb, kind of works its way up the arm and the back. So it goes into the thumb, the wrist, the elbow, the shoulder, the neck, and the lower back. Basically, this is a book of exercises you can do if you're having pain in a certain area, like your shoulder. These are exercises you can do to get rid of the pain, or just to prevent pain, which is really like one of the big purposes, stay out of trouble. There's a high rate of work-related musculoskeletal disorders when it comes to sonographers. So this will kind of keep you out of trouble. Well, there's a lot of tips and stuff here, too, to get you out of trouble. Just a little bit about it real quick. Starts with like the thumb. Like for instance, here's a distraction technique for the thumb joint. If you have like thumb arthritis or you have an overworked thumb joint, arthritic thumbs, they just love to be distracted because it just kind of takes all the pressure off of them, gets circulation to them. A couple of muscles that really stabilize the thumb joint: first dorsal interossei and abductor pollicis longus. And here we're talking one exercise, takes you like a minute or two to do. You just do it a couple times a week. And that'll strengthen the muscle and really support the thumb joint. How to instantly lower pressure in the carpal tunnel. No scanner wants carpal tunnel syndrome, which is caused by increased pressure in the carpal tunnel. So if you do this technique a couple times or frequently throughout the day, it'll drop the pressure and keep you out of trouble. Wrist distraction techniques. Those are some wrist strengthening. Spends a lot of time on the wrist here, how to increase wrist circulation. At the end of the day, of a long day of scanning, doing multiple scans, your overworked wrist could use a little bit of increased circulation. Go into things like contrast therapy, where you alternate heat and cold. Really just kind of flushes out all the toxins, kind of resets the muscle. Really feels good. Has like a massage technique with a tennis ball you can use. And goes a little bit about splints. The shoulder goes into rotator cuff strengthening. So if you want to avoid shoulder trouble, if you do a lot of scans, causes fatigue in your muscles if they're not strong enough. The rotator cuff really stabilizes your shoulder joint. Your shoulder is a very shallow ball and socket joint. So if you get fatigue in the rotator cuff, you start to get extra motion in that ball and socket joint. And that causes things like bursitis and tendonitis, things like that. So here again, you get a strong rotator cuff, you have a really strong shoulder. Scapular stabilization exercise has, just some stretches for your shoulder you can do, really feel good. And the neck strengthening exercise has a couple neck stretches, well, more than a couple. And ends with the low back. Basically has some stretches. Also has multifidus strengthening. If you're having any kind of low back problems, whether you're into sonography or not, basically, it says here, the multifidus muscles of the back are the key stabilizers of the spine. Strengthening your multifidus muscles is a proven way to prevent and treat low back pain. And actually, if you Google it, there's a lot of research on that. A lot of randomized controlled trials showing that if you go ahead and strengthen the multifidus muscles and you just do that alone, you're going to get rid of your back pain and prevent a lot of back pain as well. So anyway, just another resource for sonographers. But yeah, if you're interested in peripheral nerves and focal neuropathies, I think this is a great resource, so check it out.